When I look in the mirror, I have a little pooch, and I've always had it since even when I was younger, which I can't seem to get rid of no matter how many crunches I do. With the latest fashions right now where everything hits just below the stomach, it's not a very pretty sight. I want a nice toned body, and of course, hopefully a flat stomach. I'm a little nervous. I wasn't nervous until this day, the morning of.
Hi, Kilda.
Hi.
Good morning. Are you ready for your surgery?
Sure am. I think anybody would be nervous, actually, just before going into some type of surgery.
Hi, good morning.
Good morning.
This is Dr. Cordray.
Hello, nice to meet you.
What I'm going to do is have you swing around here. You actually just lift this up.
Right.
Are you comfortable like that?
Yeah.
Okay. I'm going to try to make your, give a little more of that hourglass look by getting into the flank area here. But this makes a nice difference when we do this. You can just see as I squeeze her with it. That's going to be very nice. That's a good area. It works well. And then we're going to do your inner thighs and your knees. Take good care of you. Give you a nice result.
My stomach is calm. I feel calm.
I think in Kilja's case, she lost her husband recently, and that may be something that kind of makes you stop and think about life and think about what you want. Maybe that was one of the precipitating things that led her to have her surgery at this time.
To walk through the gauntlet here.
Yeah.
We're going to do quite a bit of lipo. She's got a very thick layer of fat. I want to get around to her back to kind of give her that hourglass sort of look. Kilja is an excellent candidate for liposuction. She really does have some discrete localized areas of excessive subcutaneous fat, but she's not really overweight. The plastic surgeon is doing liposuction. The most important thing isn't really how much you remove, it's how much you leave behind. You want to make sure that you leave enough subcutaneous fat so that the patient has normal contours, doesn't have dimpling, irregularity, or any asymmetry. Those are really the risks of liposuction. Suction off. This flap here actually feels very thin. I don't want to go any thinner than this anywhere, but with this little pinch test, you can kind of roll your way across and see. We actually pinch the skin and see how thick the layer of fat is and determine how much fat we've left under the skin. This is thicker, right in here. Power on. Well, I think we're just about there for their abdomen. Now we're going to do the inner thigh. You're really in contact with the patient's body in a way that you aren't with a lot of other surgical procedures. She looks very symmetrical. I think, Dr. Feldman, she looks symmetrical to you? I mean, the whole contour of her body is completely changed. I'm very happy with it. Kilja's liposuction surgery went very well. We were able to remove a very large volume of fat. We took out a total of about 3.6 liters to 5 or 6 pounds of fat. And when that comes off of just the right areas, it makes an enormous difference. That's a nice amount to get off in one day. That would take many months of dieting and exercising.